The third edition of the Brain Trauma Foundation's guidelines for the management of pediatric severe traumatic brain injury update the second edition after 7 years. What are the main indications?
Well, the main findings, and there were quite a number of them, probably the most important is the higher level of evidence for the use of hypertonic saline in the treatment of children. And not only is there higher level evidence, but also there is support that it improves both the intracranial pressure and the cerebral perfusion pressure. Some of the other important recommendations related to the management of hypothermia and temperature. And that developed because between the first and the second and the third edition of the guidelines, there were several very important studies that were done. And that is another level 2 recommendation against the what we would call prophylactic use of hypothermia. That doesn't take away the use of hypothermia in complex cases where the intracranial pressure becomes refractory. That's still a level 3 option, but prophylactic use we can recommend against it. Another really valuable recommendation, it seems like a simple recommendation, but I think is really important, is we were able to make a recommendation for early starting of nutrition. You have to remember, these are comatose, critically ill children, and oftentimes we get tied up thinking about treating the brain, but starting nutrition within 72 hours is strongly associated with favorable outcome. Seems simple, but I think it's pretty important. And I think overall those were really the 3 most important new recommendations out of the guidelines. There are a number of others that are either smaller changes from prior studies or other modifications, but I think those were the 3 biggest recommendations.
And these guidelines were written as the ADAPT trial was coming to a close. Do we have preliminary results from the study?
The ADAPT trial, for those of you who don't understand it or know about it, is called a comparative effectiveness trial. And it involved 48 centers worldwide, and it has enrolled 1,000 children with severe head injury and ICP monitoring. And that study, of course, took several years to do, and then all of those children were then followed for 1 year outcome. And the results of that trial, I could say in two kind of phases. The first 200 patients have been recently published from the first 200 patients. They're not the definitive findings, but we've learned quite a number of things. I'll give you one example. For instance, in the 48 centers, remarkably, the prevalence of child abuse as the cause of head trauma was over 18%. And getting those kind of numbers is always very complicated, but in this case, with all definitive cases, it was over 18%. It may have been as high as 25%. So that gives you an example. With regard to treatment, of course, the treatment studies have to wait for the 1 year follow-up. I can tell you that all of the 1 year follow-up is done, and this is the hard work of Dr. Michael Bell, who was the principal investigator, and Dr. Stephen Wisniewski. And Michael Bell is at National Children's Hospital in Washington, D.C., and Dr. Wisniewski is at the University of Pittsburgh, where I come from. And the 1 year outcome studies are done. They're all done. Several of, I do know the results of several of the findings, but they are embargoed. I can tell you that several of the papers with results on topics such as cerebral spinal fluid drainage, glucose management, osmolar therapy, temperature management. Several of those have been submitted to journals, and several are also in the midst of being written. Probably what I could say to your audience is that being the author of the first author of the guidelines for the management of severe head injury, it's great and sad to see that the guidelines will be very likely significantly modified as the results of the ADAPT trial, because, as I say, I've seen some of the results, and we should have publications out very soon.